And this is a big danger. If you don't have a lineage, if you don't have teachers, there are places to fall off a cliff. I'm Dr. Jared Jones. My research covered ancient systems of meditation, the cognitive science of meditation, Buddhist philosophy, and the philosophy of science. I was asked by one of my followers this question, and I thought I'd go a little bit deeper than you've probably looked into the research into the cognitive science of meditation to give you some idea of the field as a whole. As a brief caveat to this, my degree is in philosophy and religious studies. My master's degree, I looked at the cognitive science of meditation as a philosopher and student of religious studies. And I looked at cognitive scientific research from about 1960 until about 2020. So I'm not a trained scientist, I'm not a cognitive scientist, but I am quite enthusiastic about this research and I've done quite a bit of work with it in the past. Bear in mind that I'm looking at this from the point of view of a religious studies person on the one hand, and on the other, I'm going to be filling in some details based upon two things. One, my knowledge of ancient systems of meditation, primarily Buddhist ancient systems of meditation, and two, I've managed spiritual communities online with about 1 million members over the last decade. And so I've just gotten to see a lot of people come and go and make progress or have problems with meditation. And so I'm going to be filling in some of the gaps based upon that knowledge, not just the current state of the research. I will be reaching beyond the research to make non-scientific statements from my own experience. Let's carry on. So first, it's worth noting that there's quite a bit of research that's gone into meditation and chronic pain, also acute pain, but I'm not going to put that on the screen. It's very much the same as you're going to see here. In brief, meditation has been scientifically shown in numerous randomized control studies to reduce pain intensity, to enhance pain tolerance, and to improve the quality of life for those with chronic pain. So, in brief, one of the benefits you can expect from meditation in general, and in particular, body awareness practices and some progressive release practices in terms of muscular tension, reduce the amount of pain in the body and to enhance your ability to withstand pain. So, in terms of the way that I train people in meditation, for example, I put body scanning practices second because it increases your pain tolerance and it reduces your subjective experience of pain and may actually, in fact, reduce pain in general. Since this is the case, it allows you to sit in meditation longer while also making your mind much more stable, much more calm. That a fair amount of research has been done on meditation and autism. And once again, not over a short period of time. This is from my experience as well, talking with people that are in meditation communities. So this is going to go beyond a little bit beyond the scientific evidence here. People who are having difficulties arising from symptoms related to autism can benefit from various styles of meditation. So, in particular, this study indicated that young children could benefit from doing mantra recitation practices, and that there are a number of benefits that people with autism get from training in meditation. More anecdotally, I have a teacher who was very, very autistic when he was young, who was told he would be basically incapable of living anything like an ordinary life, and now teaches people with autism how to meditate so that they can have much more ordinary lives. And he's a very capable person. He runs a tech company. He has a family. He has kids. He's done work for the UN. He's lived a very full life and continues to live a very full life. If he didn't tell you, you probably wouldn't know that he has suffered and to a degree continues to suffer from autism. So, over a long period of time, not a short period of time, these practices in terms of the scientific evidence, there's some indication, right? We're not quite there yet. We can't say, oh, we've decisively proved this, but there's some indication that training and meditation can improve autism symptoms and improve the quality of life for people with autism. So they've done some experiments looking at whether or not you could use meditation to address the depressive symptoms, in particular of bipolars. And they've found, at least in one study that was of a reasonable size, 311 people, that yes, you can provide some benefit to people who are in a depressive state using certain types of meditation techniques. Furthermore, in a more recent study, they found that mindfulness meditation may help and improve people that have anger or aggression issues related to their bipolar disorder. And in this study, there were indications that for people with bipolar disorder, they may need more support, in particular when they're depressed. And interestingly, that during your manic symptoms, this could both be a barrier to you doing more practice, but also if you're in a state of mania, sometimes it might facilitate your practice because you have much more energy to do things, right? And so even being in a state of mania doesn't exclude you from being able to train in meditation, nor does depression, though when you're depressed, you may need more help to carry out the practices. And all of this, I think, is makes a lot of sense. Once again, speaking anecdotally, I have a friend who trained with the same teacher as me for many, many years and suffered from bipolar disorder. He used to take almost like a handful of pills every day, and over, I think it's been 18 years now, 19 years, he's reduced the amount of medication that he needs to take to manage his condition. So there's some indication, both from my anecdotal experience and from the point of view of modern science, that if you have bipolar disorder, you may benefit from some training in meditation. Next, post traumatic stress disorder. This is a bit more complex, of course, but conclusion, all categories of meditation studied were helpful in mitigating symptoms of PTSD. Transcendental meditation, which is a type of meditation that primarily relies upon mantra recitation, produced clinically significant reductions in PTSD for all trauma groups. So, once again, with the right support, with the right resources, and with the right techniques, you can see some improvement, according to modern science, in things like post traumatic stress. Next, attention deficit hyperactivity disorder, ADHD. Overall, these findings support the idea that deliberate cultivation of attention using MT, which is mindfulness practices, may prove a useful strategy to ameliorate residual inattention after pharmacological treatment of ADHD. However, adequately powered prospective studies of the relationship between meditation and inattention ADHD populations are needed to firmly establish efficacy. So, here once again, it sounds to my ear like they're saying continue to take your medications so that you can get to relatively good function. And then these techniques of training and meditation and mindfulness could improve your overall prognosis. However, the science is still young. The science is still young, but it seems like some of the data indicates that this could improve your prognosis with ADHD. Speaking from my own experience, I was diagnosed at, I think it was age 15 or so, with undifferentiating adult attention deficit disorder. And I still have some of the symptoms of that, but they've been reduced to such a level that I don't need to take anything for it. And, once again, this is anecdotal. Not everyone's going to be the same. It's been my experience, and people in my community who have been training for a long time, it's been their experience that over a long period of time, that you can improve these mental conditions using mental training. Now, a bit more extreme example. There are some medical studies that they've now done quite recently, actually, in the last 8 years, where they've looked at patients with schizophrenia who have a 20-year history of schizophrenia. In the study, though it's of small size, they're doing 8 months of intensive mindfulness meditation with the help of doctors. Okay. This is not just people going out and doing a ton of meditation on their own and then stopping their medication or something. Don't do that. But under the guidance of professionals and with the help of their doctors, and I'm assuming also probably continuing to take all of their medications, what they've seen, in brief, our results demonstrated the promising potential of mindfulness meditation on the management of severe chronic schizophrenia patients. So there is some potential also that by gaining more control of your mind, that you will be somehow less subject to the types of hallucinations and delusions that people with schizophrenia suffer from. Looking at an article that has a great deal of these resources put all in one place, meditation can help with stress and anxiety. It can help with blood pressure. It can help with insomnia and sleep quality. It can help treat substance abuse. There's been some indication that people who have cancer, for example, they looked at 29 different studies, a total of 3,274 participants, where they were using mindfulness based practices with people who had cancer. And they found that people that were doing these practices had significantly reduced distress, fatigue, sleep disturbance, pain, anxiety, and depression associated with the diagnosis of cancer, the treatment of cancer. This is a pretty significant finding that even under life and death conditions of great pain, great difficulty, great, great significance in your life, that training in meditation can benefit you on a whole number of levels. Some of those are very personal in terms of pain management and so forth, and some of them are more general, that it allows you to change your worldview, improve your worldview in such a way that you don't have as much anxiety and depression and so forth. Also, in terms of weight control and eating disorders, there's been a few studies on this, and they found that training in meditation along with other things can help you lose weight. In this article from 2022, looking at the adverse events of mindfulness meditation, basically what they've found is, in to put it in my terms as a someone who trains intensively in meditation, for people who don't really train very hard and do very short amounts of meditation without sort of going very deep into meditation training, there's not much risk, there's not much danger of anything happening. However, for people who train intensively in meditation, it is a very difficult thing to do. And there are dangers involved in training in meditation because you're working with the thing that generates all of the rest of your reality as you experience it. So if you're changing the thing that generates every other experience you have, that has the potential to go wrong. So, as they say here, mindfulness is not for everyone, right? Training in even mindfulness, training in meditation in a really serious, intense way is not for everyone. And in particular, what you need to have if you're training seriously in meditation is an adaptable, trained teacher, a trained professional. Basically, to translate this out of the scientific language, you need a lineage. You need gurus who have been walking down the path before you, so that when things happen, they can give you advice on what to do, how to deal with it, and some of that advice, especially in the 21st century, might be you need to go to a conventional therapist, or you need to deal with whatever's come up in a conventional way, because meditation really does trigger all of the worst things that you've ever done to appear in your mind and to become very vivid, and it becomes very clear why those things weren't right, for example. And you have to process those things out of your psychology. Similarly, there is only one study I could find. There may be other ones, and this one's very limited. They talk about unguided excessive meditation. Unguided excessive meditation. I can't tell you how many times managing large Facebook groups for meditation and Buddhism, Eastern philosophy, this sort of thing, that I've come across someone who didn't have a teacher, but for some reason was inclined to do a lot of meditation practice. They had what would be considered by people in a proper lineage to be very sort of beginner kinds of experiences, rudimentary kinds of experiences, but this made them so delusionally grandiose in their idea of who they were now, because they had those relatively minor experiences, that they entered a state of psychosis, spiritual psychosis. And they think that they're very important now. They need to spread the truth of whatever now because they've had this experience that was so profound. And this is a big danger. If you don't have a lineage, if you don't have teachers, and you're climbing a very tall, complicated mountain, there are places to fall off a cliff. All sorts of places you can fall off a cliff. And one of the primary functions of a teacher and a mentor on the path is to help you not fall off a cliff when certain things start happening. Meditation can be very good, meditation can be very bad. A little bit of meditation is basically a sort of harmless activity because it doesn't do very much, relatively speaking. Intensive meditation, doing a lot of meditation, you're changing the thing that generates the rest of your experience of reality. And when you start to do this, there are all sorts of things that can occur. You can see lights, you can have visions of things. Some of those things might be real, Huge numbers of them won't be real because your mind is in the business of making things that appear real to you. So if you start to gain some ability to turn your mind inwards and your mind starts generating all sorts of stuff that isn't real, it's going to look real. Another big problem is that people have those kinds of experiences and they don't know what they are, and they think they've achieved really profound states of spiritual realization. And because of this, sometimes they even abandon their teachers, they abandon their lineages, they stop seeking advice from people that are further down the path. And for people who are mentally unstable, they stop taking their medications, for example, and then things go very, very wrong quite often because they're now subject to schizophrenic delusions, or they're subject to extreme bipolar, or they're subject to the wanton nature of extreme ADHD, et cetera, et cetera, et cetera. And the trouble is that once you start heading down that pathway, you start to think quite often, not always, but quite often, you start to think that all of the criticism you're getting is because people don't understand that you're this great spiritual being now. And think about how dangerous and actually tragic that is, that you've cut off both those people in the West who might be able to help you with your mental condition, and you've cut off those teachers and lineages that might be able to help take you further down the path, especially if you've had some beginner experiences of really engaging in meditation that can be quite profound, right? If you've never had those experiences, they're mind-blowing. I say this all the time. If you could just see what vision is like in the absence of most of the conceptual overlays that you place on vision, you'll probably never be the same the rest of your life. And that's the beginning, not the end. This is the beginning of the process, but it's so different and so profound compared to ordinary experience. At least for me, I can't imagine how you would ever be the same after having a real taste of this. And so, because of this, people that are prone to mental illness and people that are prone to delusions of grandeur and this sort of thing, they are very much subject to potentially taking a hard left turn into sheer delusion. What do I recommend then? What I recommend is this: Buddhism and Eastern types of psychology in general, if we can call them that, are wellness psychologies. You need to be within the range of normal. And yes, we're all, we all have our own special brand of normal, but you need to be within a relatively small band of range of normal activities for mental dysfunction, let's call it, rather than mental function. And if you happen to fall over here on the spectrum of things that are beyond the normal level of dysfunction, for delusions or for excitement and depression, mania and depression, or for distractibility, then use the Western tools that bring you back to this range. And then not over a short time, but over a long time, with the help of people in these systems that are taking you this way in terms of greater wellness, right? Wellness psychology means we're going to take you from normal to supernormal to better than normal, or at least to the far end of what's possible in normal, right? We're going to make you even better, or even more well than you would expect. You can't do the work of becoming extraordinarily well if you're not relatively normal first. So I encourage people, talk to your therapist. If you need medications to get you into that normal range, take the medications, no big deal. And don't go off those medications without talking to your Western doctors first. Don't mess with your medications or reduce your medications without talking to your doctors, and yeah, sometimes you need to get a second opinion or what have you, but rely on these people. They train a long time to try to make the best possible decisions for you. They're here to help you, and they're very well trained, and most of them are very well intentioned also. And then once you're in a lineage where you're training towards a greater state of wellness, or a superior state of wellness, same thing. As soon as you have your first great meditative experience, don't go, oh, well, I'm done with that now. I'm this great being. Let me stop taking my medications now because I've had this one great experience. You need to take a long term view. Most people who are training on the path are on a multiple lifetime path. Even if you're just trying to attain nirvana, the path is going to take you multiple lifetimes, according to Buddhism, for most of us. Unless According to the Theravada, you're living out as a monastic and you're doing huge amounts of practice. On the Mahayana path, same thing, and the path might be much, much, much longer than training just to attain nirvana. So, for the rest of this life, you shouldn't be giving up your teachers. You shouldn't be giving up your lineages. You shouldn't be abandoning conventional help to become more well. And if you are, there's probably something going wrong with your way of thinking about the path and thinking about training. I've been at this for, I think, about 21 years now. 20, 21 years, somewhere in there. I've talked to two of my teachers this week about what I'm doing with my practice. So you don't give up your teachers. You don't give up your lineage. You don't give up the guidance of people who are further down the path than you, because unless you're a Buddha, and you're not, despite what you've heard in Zen, then you need to carry on relying on people that are further down the path from you to help you. And I've seen a lot of people go completely off the rail. And I'm making this video because I hope you, dear friends, don't end up like one of those people. Yes, these systems can take you way beyond normal wellness, even according to Western psychological models. And I'll put that on the screen. These can take you so far beyond normal, it makes normal look completely dysfunctional and unattractive. On the other hand, the people that get to that condition don't get there by abandoning their lineages, abandoning their teachers. They get there by relying on their lineage until they've accomplished extraordinary results, which is probably not going to happen to you in 5 years or 10 years or 15 years or 20 years. This is a lifelong endeavor. And not only is it a lifelong endeavor, according to Buddhism, it's probably a multiple life endeavor. You're going to make progress in this life if you put in sincere effort and you rely on your teachers, your gurus, your lineages. You'll make progress. There's a potential that you could become an absolutely extraordinary being in this life, but who's going to tell you this? Who's going to go, ah, yes, you've really done it now? Your teachers in your lineage will tell you. And one of the main functions of your teacher is to tell you, no, that's not it. No, that's not it yet. Keep going. You see? So, my hard advice to you, my dear friends, is rely on Western medicine to help you get to normal. If you're outside the normal range and you're dealing with psychological difficulties, yes, these practices can help you if you're relying on this other stuff to keep you in a relatively normal range. Then, over a long period, 10 years, 15 years, 20 years of training, you can make significant progress. I think, even based upon the scientific evidence, we can conservatively say, we can't say for sure, but we can conservatively say it looks like you should be able to make some real progress against these conditions using these techniques. Yeah. But even on the scientific side, they're saying, by and large, don't do unguided tons and tons of personal stuff. Find qualified professionals to help you do it because there's a lot that can go wrong if you're doing it intensively. You see? So that's all I have for you today. I hope this was worth your time. And as usual, hope to see you again soon. Try not to die before I do. Cheers.